Dr. Renee Coffman, and I am president of Roseman University of Health Sciences. Roseman University is a private, not-for-profit health professions university based in Nevada, and we have a Doctor of Pharmacy program, a BS in Nursing program, an MSN in Nursing, and an orthodontics residency program here in Nevada, and we are in the process of developing an MD granting medical school.
Hey Doug, I've got one question. What are you looking at the shortage of workforce in the health sciences, which is our state is suffering from? So are you collaborating with international organizations or bringing in some foreign students to work and learn so that we can create a workforce?
Yeah, we are working with, first of all, we get students from all over the United States, but we also bring in students from other foreign countries, and we're looking to develop those even more because the shortage is so crucial that I think the domestic supply of potential students for our programs is just not going to do enough to fill the needs. So yeah, definitely very interested in looking at collaborations with foreign countries to provide students for our programs.
So we'll work it out, one joint venture very soon.
Sounds good.
Thank you, Dan.
Thank you.
My name is Nagy. I am an attorney here in town who is running for judge in Department 7. We're here at the Mint. I am lucky to be good friends with Rita Waswani as well as Harry. It's been amazing for us, and thank you to you. And thank you to all the nurses and all the medical professionals for everything you do for our community. It's an honor to be here, an honor to learn from you, and an honor to recognize the work that all of you do. Thank you very much.
Hi, I'm Camiolo, and I'm the Region Chief Medical Officer for Intermountain Healthcare. We are excited to participate tonight and really talk about how we are investing in the community and partnering with our healthcare professionals throughout Southern Nevada to help improve care for all members of our community.
Hi, I'm Upinder Singh, Medical Director, Silver Summit, Centene Healthcare, and I just want to say that while we are making all the efforts to recruit more healthcare professionals, we need to be able to provide an environment to keep the ones who are here and help them grow also. That is the way we will be able to solve some of the healthcare issues in Nevada. Thank you so much.
Hi, I'm Karla Perez with Universal Health Services, and I just want to thank the Nevada Health Professionals Network for bringing awareness to our healthcare issues, particularly the shortages of our healthcare professionals. Thank you.
Hi, I'm Dr. Aury, Nagy. I'm a neurosurgeon here in Nevada. I'm currently Vice President of the Nevada State Board of Medical Examiners, and I want to say thank you to everybody who's helped support me in my recent run for Regent. We were unsuccessful, but we'll get them next time.
Hi, my name is Ferreira.
I'm Barbara Harrington,
and we're here to launch the Showers of Blessings. This is a project for Las Vegas community. We're providing portable showers for the homeless community.
And we're also collaborating with other organizations to wrap in clinical services for them.
Hi, I'm Andrew Priest. I'm the campus president and provost at Touro University in Nevada. We do a lot of things there. We have 180 med students in each of our cohort. We have PA, nursing, PT, OT, and a variety of education programs. And we are really trying to increase the supply of healthcare providers for Southern Nevada. And if we can get them to stay here, even better. So, great. I'm Andrew. Thanks.
So much for coming. I know it's a busy week, Tuesday, you know, it's after work. I'm like, what the hell are we doing on a Tuesday evening? Talk about healthcare issues and keep on going and talking, but tonight we're going to find a solution, at least probably a solution, a proper solution. But before we start, I want to thank everybody for coming tonight. We appreciate your presence here in our meeting room here, as we call it. But first, I'd like to call on Chris Harpreet. Where are you, Chris?
Somewhere in the pictures.
Chris, we want to acknowledge the owner of this restaurant for accommodating us the way he arranged this completely turnaround. And of course, the buffet is awesome. If you've not been here, you missed it. So, do you have table numbers? Thank you. Now, how many of you have seen Sue Tripathi Manteris on TV over the years? Wow, awesome. Okay, I am more than that. I'm so proud to call her a good friend because she's been a friend for many, many, many years. Just to give a little background of Sue, Sue was known as Sunanda Tripathi Manteris from India. She's the very first Indian American in the mainstream of TV radio broadcast when her career in commercial radio began in 1983. Oh, that's a long time. Now she was still in college. She must be very good because she got recruited, right? After graduating, Sue worked at several stations before accepting the anchor job at Channel 3. This is where you guys saw her, right?
Yes.
Yes. Where she anchored for nearly 25 years. Wow. Give her a hand. And, of course, she was inducted to the Nevada Broadcasters Hall of Fame. So she was one of those well-known anchor lady. Wow. In her second job as a TV station in Billings, Montana in 1986, the manager there asked her to change her last name. They didn't like Tripathi. Well, you know what she said? She refused and told them, "This is who I am. This is Sunanda Tripathi Manteris, now known as Sue Manteris." Give her a big hand, ladies and gentlemen.
Thank you, guys. It's great to be here and see everybody again in person, right? Okay. I was going to say, are we back on South Asian time? I think a little bit. But let's get moving here. And yes, I'm getting older, so I'm starting with the glasses already here. But it's great to see so many wonderful faces I haven't seen in a long time. So here we go. Here we are. We do want to recognize some of the VIPs and do the table sponsors as well. So here we go. Joe Ferreira, President and CEO of Nevada Donor Network.
Hey, Joe.
Stephen Peralta, Nevada Donor Network Foundation President. Oh, didn't make it. Dr. Andrew Priest, newly appointed Toro President and Provost. Kareem Casey, Medical Group President of Intermountain Healthcare. Dr. Federico Zaragoza, President of College of Southern Nevada. Colonel Linda Hagerman, Deputy Commander of the local military hospital, Michael Callahan Medical Center. Dr. Jodi Hassan, cardiologist, UMC and member of Medical Board of Examiners. Dr. Benito Calderon, Chief Medical Officer of Nevada Community Health Center. Karen Rubel, President and CEO of Nathan Adelson Hospice. Steve Chong, Director of Development, UNLV School of Nursing. Nakia Jackson, Assistant Dean for Administration, Outreach and Engagement, UNLV School of Nursing. Dr. Rigo J. Tan, Assistant Professor, UNLV School of Nursing. Ann Brown, President of Alliance for Nevada Nonprofits. Liz Gamboa, President of the Philippine Nurses Association, which has more than 300 members. Las Vegas City Councilwoman Victoria Seaman. And some other have a guest that we would like to mention here today. Max Berkeley is here. There's Max. He's a lifelong Las Vegas, currently Clark County Public Defender for 10 years. He is running for Las Vegas Justice Court. And if the name Berkeley sounds familiar to you, you know why. He's the son of our very good friend and board member, Shelley Berkeley. Yeah, she's on a cruise. Is that what you said, Max?
Yep.
Okay. So that's why she's not here. So we do want to tell you a little bit about the organization and who's behind it, how it all started. And the man behind this project, of course, is Harry Singh. Harry, oh, there you are, right there. Harry, President of Business Strategies of HR Global Consulting. Harry launched his first project, Nevada Community Health Center, to serve the underserved, uninsured, underinsured, and undocumented community in Las Vegas, which is at 1311 South Maryland Parkway. He needed strong community volunteer support and discovered that there was a big disconnect among healthcare professionals. He started Nevada Health Professional Network to connect healthcare professionals for activities for community service. He was successful in recruiting strong community leaders and board members. Harry's now involved with projects for autism and Down syndrome. October 1st is the poker run. We still have more to do, provide health care to our community. So please join our network and support our activities. I think you've got those on your table too. Membership papers hopefully are there. You can hopefully become a member. So we are proud to announce the chairman of the board of Nevada Health Professional Network, Stephen Peralta, also the president of Nevada Donor Network Foundation. Oh, I'm sorry, are you going to fill in?
You're going to get Just Joe.
Just Joe, I like that. Just Joe. Okay, Just Joe, come on up here, Joe.
Okay, so I am no Stephen Peralta. For those of you that know Stephen, he couldn't make it today due to another obligation, but he asked me to say a few words. And first, I'd like to just say it's an honor to be in the presence of the prominent healthcare community that we have here in Nevada, and specifically in Southern Nevada, to advance this effort. We at Nevada Donor Network are the organ, tissue, and eye recovery agency that is based here throughout the state. So we have a presence here in Southern Nevada, obviously, and also in Northern Nevada. And we couldn't do what we do in saving and healing lives through donation without the powerful network that's here and those that couldn't join us tonight. So on behalf of Nevada Donor Network and my friend Stephen, who runs our foundation, I want to thank Harry for allowing us to be part of this, knowing the importance of the healthcare talent that we need here in the state in general. And because we are interlinked with all of the professionals, the doctors, the nurses, the executives that run the hospitals, we rely on the same resources and the same network to be able to execute on our life-saving mission. So I want to thank Harry for allowing us to be a part of this, to sponsor this excellent initiative, and in working with all of you, I want to thank you for your support of organ, eye, and tissue donation, because frankly, again, we couldn't do what we do without your assistance. So thank you for allowing us to be a part of this.
I'm going to keep you up for a little bit longer. I'd also like to thank our sponsors here today, Royal Springs Healthcare and Rehab, there you go, Emerald Medical Center, Integrated Multi-Specialty Medical Group, Dr. Ferreira, Vegas Valley Primary Care, Dr. Alok Saxena, Showers of Blessings, Odessa and Barbara, Intermountain Healthcare, Nathan Adelson Hospice, Roseman University, Companion Insurance Agency, Liberty Mutual, GMT Non-Medical Transport, Tommy Davies and Austin Covington, Care Hospice, College of Southern Nevada, Dr. Federico Zaragoza, Nevada Donor Network, Dr. Aury, Nagy, and Charter Healthcare. Now give it up for everybody. All right, we kept you guys up here because we do want to bring up the board members now, and we have a chance to thank them for pictures and everything else. We do want to get them all together. Okay, so here we go. Steven, okay, Steven's not here. We got that. Joe, we got just Joe.
Just Joe.
Karla, Perez. Karla? Where's Karla? There she is. Renee Coffman, Hannah Brown, Dr. Jodri Hassan, Dr. Jaitan, Dr. Bender Singh, Donna Miller, Jennifer Bradley, Yvonne Stevenson, Faith Ramos, Rita Vaswani, and the board members not in attendance, Shelley Berkeley, Dr. Maran Shaker, Dr. Adi Prabhu, and Sanjita Khanna. So give them a hand, everyone.
Okay, eyes here, guys. Rita, 1, 2, 3. One more.
Thank you.
Okay, folks. On behalf of the Nevada Health Professionals Network, we are proud to present our distinguished speakers. For about 3 to 5 minutes, they will present their own perspectives on healthcare needs, human resources, services, and solutions. So we're going to call our first speaker, Karla Perez. Karla is Vice President of Valley Health Systems, which we all know includes, if you don't know, Valley Hospital, Summerlin, Desert Springs, Spring Mountain, Centennial, Henderson Hospital, West Henderson Hospital, and there's a new one coming up soon. And Karla's going to be talking about perspective on healthcare needs, planning, and solutions.
As Sue said, I oversee hospitals across the entire state of Nevada. I've had the fortunate opportunity to oversee 10 different hospitals, ambulatory surgery centers, outpatient facilities, rehab facilities, pharmacy, physician practices. We've been incredibly fortunate that our hospitals have also been recognized with numerous quality awards over the years, and including Henderson Hospital just recently being named top hospital in the country. So wonderful distinction for that hospital. We've actually done that for several years in a row now. We've just also recently opened a brand new hospital in Reno, Sierra Medical Center, the first new full-service hospital built in Nevada in over 100 years. And just recently broke ground, and if you've driven along the 215 and St. Rose Parkway, St. Rose Parkway, that was 215, you would see our new hospital, West Henderson Hospital, under construction. We now have steel up, and we're very excited about that project that will open in the spring of 2024. The problem, though, is in order to continue to provide these quality healthcare services and to expand our services to our community, we need qualified workforce. And as I think everybody knows, there is a significant shortage of healthcare workers. Obviously, there's a lot of industries that are experiencing labor shortages, right? You've gone into restaurants that have half the tables closed or they change hours. Unfortunately, in healthcare, we can't do that. We can't reduce our hours. We can't just stop providing services. So it's imperative that we really focus on developing a stream for our healthcare workers to come into our hospitals and other healthcare services across the state. Just to put it into perspective, I found a statistic that said 1.9 million Nevadans reside in a primary care health professional shortage area. That 67% of the state's population is residing in an area where they don't have access to primary care. That's really incredible when you think about that. From a registered nurse perspective, in order to just meet the average national population to provider average, and again, this is just the average, Nevada would need to recruit an additional 2,200 physicians and 4,400 registered nurses. So you can think about that, how it compares to the shortages that we're experiencing today. You can understand why people don't have access to primary care and why we're experiencing such significant shortages in nursing. In order to address some of these healthcare shortages, UHS, the company that I work for, has invested a significant amount of resources to expand our graduate medical education program. We now have residency programs in internal medicine, family practice, orthopedics, general surgery, pulmonology, and just recently announcing an expansion into psychiatry as well, because there's certainly a significant need for expanding behavioral health services in the state. This program, of course, requires a significant investment of both capital dollars as well as commitment from our medical community. We couldn't do this program without the medical community and the faculty positions that they serve for our hospitals across the state. From a nursing perspective, I found an interesting statistic here as well. You know, we talk a lot about the nursing shortage, but interestingly enough, over the last 10 years, the number of licensed RNs in the state of Nevada has actually increased by 47%. But yet we still are 4,400 nurses short, which basically tells you we have had a shortage for a very, very long time. And certainly the pandemic has escalated the shortage and the fact that we are now losing nurses from working from at the bedside. So we must all work collectively together to encourage our next generation to consider healthcare as a career opportunity. We have to grow our own. In the Valley Health System, we've created what we call the university, although it's not a licensed university. It's really a learning center. But a lot of nurses who graduate as general practitioners in nursing. And what we really need is specialty nursing as well, right? We have to have ER nurses and ICU nurses and OB nurses. And many of them don't come out of nursing school with that level of education. So we've developed a program to provide that specialty level of nursing. And certainly one of the things that the Nevada Health Professionals Network is doing is offering scholarships for individuals who are going into any of our wonderful education programs across the state. You're going to hear from a couple of them today. We also have to figure out how to stretch the existing healthcare workforce. And one of the things that we have done is we've created a team nursing concept. And what this does is it allows the nurse to take care of more patients, but operate at the very, very top of their license. You know, typically nurses get a patient assignment and they do everything for that patient. What this does is it pushes those tasks that don't necessarily need a nurse to do, but a lower level healthcare provider could do, like getting the patient up to walk to the bathroom or walking through the halls or those kinds of things. And so we've added a lot more support staff to our nursing teams as well. And then of course we are recruiting internationally, and thanks to Harry for some of the work that he's doing, going to the Philippines to bring nurses into our communities. But we also have nurses from Canada, from London, from India, who are all coming on board, assimilating into our environment. So just to summarize, it's incredibly important that we continue to support the Nevada Health Professionals Network and the work that they're doing to bring visibility to all of these issues in healthcare and to grow our healthcare workforce. Thank you.
Thank you, Carla. Carla touched on this a little bit. We're going to hear more about it because coming up now is Dr. McCoy from the College of Southern Nevada, and he will be talking about the shortage of healthcare professionals such as the nursing workforce and the new collaboration between Harry and CSN.
Well, thank you very much, Sue, and good evening, everybody. Like Just Joe, and I'm Just James, and you don't get Dr. Federico Zaragoza, our president, today. He called me about 10 minutes ago, 10 minutes prior to walking into this room, in fact, and he says, I've got COVID.
Oh no!
A second time in 3 weeks. And my wife also does as well. I said, hey, we're walking into a room of healthcare professionals, so we'll make sure we get a lifeline out to you right away. So he sends his immediate regrets, but we thought it better him stay home, obviously, in this environment. So my name is James McCoy. I serve as the Chief Academic Officer for the College of Southern Nevada here in town. You heard of it? Yeah. We are a workforce engine. We believe in this ecosystem, and in the context of health education, we're really proud to be your partner as we fulfill these incredible workforce needs that we just realized again moments ago. we are incredibly passionate to have partnered with Harry. I think about the first experience we had with you, Harry, as you brought this incredible idea to us. You said, hey, at the College of Southern Nevada, and if you don't know, I mean, we service about 30,000 students annually in credit programs, another 10 to 12,000 students in non-credit programs each year. And we're kind of a workforce engine in a variety of different disciplines, from welding to HVAC, right, to all the healthcare sciences and allied health support areas that we can. And then our secondary mission, of course, on top of that in parallel, is to service a transfer population, right? So we're preparing students with their basic transfer level skills so they can enter med school and successfully be after their first 2 years at our college. We offer a variety of bachelor's programs, and in the health science area, did you know we've even got one in cardiorespiratory sciences? Did you know that? Did you know that? So I hate to say, every time I hear that CSN is oftentimes this community's best kept secret, but I know the secret will leave this room and get out in this community. So, in the context of workforce development and what we're looking at, in particularly in the area of nursing, I want to touch on a program that you just mentioned and that you just introduced, Sue. And that's our partnership with Harry and this ideology that if we're going to meet this 4,400 gap in RNs in this community in short order, we've got to look beyond the borders of Nevada. We're doing everything we can, and of course CSN and a variety of other higher education professionals in this valley are producing as many RNs as we possibly can. It's not just there, right? It's LPNs, it's CNAs, it's medical assistants, right? It's all the allied health areas around surgical tech, right? It's radiation therapists, it's sonographers, it's dental hygienists, it's all the things. But in the context of nursing, these numbers are boggling. 4,400 missing in this valley just to sustain the needs of our current workforce. That against the population growth that we have realized and will continue to realize in this great region that we call home, the demand is only going to get higher. So Harry approaches us and he says, about these borders, what if we were to create, in partnership with the College of Southern Nevada, an opportunity to bring RNs, licensed RNs, from places like India, from places like the Philippines and Africa. And these are practicing nurses. These are nurses who are great at their trade. They're working every day, 5 years strong or more in their field. We have an opportunity to bring them in, and that word assimilation comes to mind, as you just mentioned. We have an opportunity to help wrap around them, provide in-class support bridge programming, very specific in those very niche areas of RN program that you were just talking about. And so in an accelerated way, how many thousand RNs can we bring in on the international landscape into this state? How many thousand? And how many thousand can we pump through, Carol, through this NCLEX program in a very preparatory way? How many thousand? And what can we do to help support from a wraparound service standpoint to make sure that not only are we training and preparing these nurses to be successful in our healthcare provider environments right here in Southern Nevada and throughout this state, but to keep them here. That's the key. And so Harry, we're proud to partner with you at the college. We're excited to see this program launch. We're beginning to recruit, I know, in a couple of weeks. So we're excited to welcome these new students to CSN in short order. Thank you again for being our partner. Thank you for allowing us some time.
Thank you, Just Jim. And their trip apparently is scheduled for August, right, Harry? Is that right? Yeah, they're going to the Philippines in August. Okay, first recruitment. Awesome. Okay, now we are going to bring up Dr. Renee Coffman, BS Pharma, PhD, President of Roseman University of Health Sciences. Roseman, founded in 1999, is a private university focused on healthcare, business, and technology, located in Henderson and second campus in South Jordan, Utah, nursing, dental, medicine, orthodontics, and pharmacy. And topic will be the importance of education and initiatives of healthcare workforce to meet the demands of the present time.
Good evening, everyone, and thank you, Rita, for inviting me to speak tonight. And just kind of taking a little bit more from what Sue said about Roseman. Roseman is a private, not-for-profit university that focuses on health professions education. We started back in 1999 and started the first Doctor of Pharmacy program in the state of Nevada, and we still are the only pharmacy program in the state of Nevada. So I'm really proud to know, and I see this when I go out to my pharmacy, that a lot of the times I am helped by a pharmacist that graduated from Roseman University. I'm very proud of that. In our mission statement, we talk about meeting the healthcare needs of the communities that we serve. And that's how Roseman has grown over the years. Very early on, when we started with just the pharmacy program, our partners in the hospitals in particular came to us and said, we need more nurses. I think I had a conversation with Karla probably back in the early 2000s about needing more nurses. So you heard a little bit about the current status of nursing shortage. This isn't new. This has been around for almost 20 years. But in response to that request, we built a BSN in nursing program. And as we have grown, we've expanded that to a master's in nursing, nurse practitioner program. We have on the drawing board a PhD in nursing program and also a nurse anesthetist program that are coming down the pipe. We started an orthodontics residency program, provides great orthodontic care at a reduced cost, cutting edge technology for orthodontia here in Southern Nevada. And we mentioned, Sue mentioned that we have a campus in Henderson and a campus in South Jordan, Utah. It came down to 215 to get here. You also probably passed our newest campus in Summerlin. We acquired the buildings that used to be part of the Nevada Cancer Institute specifically to develop a College of Medicine. And we have some of our colleagues here tonight that are part of that developing program. And so the need for health professionals really does run the gamut. Just in terms of talking to our partners, it's all the way from technicians, radiology technicians, respiratory therapists, all the way up to MDs and MD specialties. So there is a dire need here. And education can help to fulfill that role. And I was going to say, I was going to be really Renee since we had just Joe and just James, and I'm really Renee. But I hope I'm not Debbie Downer, because we're really sort of in a bit of a perfect storm here. It might be the reaction just to say, okay, we can build new schools, build new schools, build new skills, and if we build new schools, the students will come and it's going to solve all of our problems. But the perfect storm is this. There are fewer students graduating high school today than there were 5 years ago and 10 years ago. We're in a demographic issue where the number of students graduating from U.S. High schools is declining. And if you think about the health professions, typically it is, you have to have a certain grade point average to get into these health professions programs. So a smaller slice of that declining piece of the pie is eligible to go to some of these health professions programs. So we can build schools, we can build new programs, and in fact, one of Roseman's initiatives, our strategic initiative, we've labeled 5005. What that means is currently we have about 1,500 students enrolled in our programs. We want to get to 5,000 students within the next 5 years by building additional programs, not just nursing, pharmacy, and medical, but mental health programs, some of these other ancillary nutrition programs such as that, because they're in such dire need. And we can build those, but if we don't have the inputs, meaning if we don't have the students available and qualified to get into our programs, there's still a problem. And so I do appreciate Harry thinking outside of the box by going outside the country and bringing in professionals from other countries. I think that's part of one of those solutions. We also have to get down into our high schools and talk to students there about the potential in healthcare professions. You know, we're, depending on who you talk to, we're entering a session, we're not entering a session, everything's fine, everything's not fine, I don't know. But the one thing I do know is that healthcare professionals are always in demand. I graduated from pharmacy school at the same time that Sue was getting into broadcasting, and there has never been a let-up of demand for healthcare professionals in that time. And that's a long time. My birthday's next week, so it's a long time, believe me. So having students understand the great investment that they make in their life and in their future by going into a healthcare profession is something that we can't spread the news enough about. I appreciate that this group is doing scholarships. We need more of that. We need to reduce barriers to students going to college, whatever that means for those students, whether it's helping academically, whether it's helping with financial support. But we need to get more input into these programs, or it doesn't matter. We can build 50,000 buildings that has opportunities to have students come in, but if the students aren't there, and I suppose you see that at CSN as well, it's a challenge sometimes to meet those enrollment opportunities that we have to offer. So again, appreciate the opportunity to speak with you tonight. If you have an opportunity to help a student get into a health profession by providing scholarship dollars or helping with academic support in any way, I would encourage you to make that part of your community support and what you dedicate yourself to, because there's going to be a time when you or someone you love needs medical help. And you don't want to be in that position where, gosh, I rang the bell, but there weren't enough nurses to come and help my spouse get to the bathroom or do whatever they need to do, or the respiratory therapist there to treat this condition. So think about that. We need more students, we need more qualified students, and we need to invest in our education. So again, thanks for the opportunity and appreciate it.
All of these speakers have been amazing. You guys are so awesome. All right, our next speaker, oh no, now she's really gonna get me out. Okay, I've got a lot to look up to now, but it's Dr. Cara Camiolo, Regional Chief Medical Officer of Intermountain Health, and Cara is going to be talking about the initiatives on healthcare and development for best health practice.
And good evening, and I recognize I may be the person between you and some really good food. So thank you for the invitation tonight, Rita. I really appreciate it, and I'm honored to be a part of the Nevada Health Professionals Network. As a member of our Intermountain community, I am Cara Camiolo. I am the Region Chief Medical Officer of Intermountain Healthcare, and I am a physiatrist by training. My clinical background is in the care of persons with traumatic brain injury. And I wanted to at least give an overview of Intermountain Healthcare for those of you who may not be familiar with our organization. We have a footprint of 7 states and have 33 hospitals, including 1 virtual hospital. Here in Nevada, we operate 60 clinics, half of which are dedicated to the care of seniors in our communities. We serve about 400,000 patients here in Southern Nevada, and 80,000 of those are in our senior clinics and populations. When we think about our commitment to the community, it comes back to our mission as an organization, which is helping people live the healthiest lives possible. And we think about that in 3 ways. One of them is how we invest together as a community. The second is how we grow together as a community. I think we've heard a lot about that already. And then lastly is how we integrate together as a community. And so when we think about the first, which is investment, our organization is a not-for-profit organization, and as part of that, we recently completed a community health needs assessment. And so we went out into the community, we talked with stakeholders, we talked with patients, we talked to our own caregivers who work in the community. And we asked the questions of where are the areas of greatest need? And although several things rose to the top, it's probably not a surprise to you all to hear that mental health was one of the primary concerns that we heard. And so when we think about investment and we think about our commitment to the community, it's how we invest together to help bolster the needs of our community around mental health. But then that speaks to how we grow. And that, I think, resonates really well with what we've already talked about in growing the pipeline of patients who are helping to serve our community and entering healthcare professions. One example that we've had at Intermountain Healthcare is we recently partnered with the Southern Nevada Goodwill and Nevada Careers to create the 90-day medical assistant program, where persons who may not otherwise have the financial means to enter a healthcare community are supported in entering those careers and given a path so that they can practice in a reasonable amount of time. Those are the types of programs that we want to continue to invest in to grow the diversity of our workforce, but also make sure that, to what's been mentioned several times, that we're committing to keeping folks here in Nevada to grow and serve their community. We know we have a physician shortage, we have a nursing shortage, we have a healthcare professional shortage. And our commitment to partnering with our local universities to create pathways for nurses and medical assistants and medical students and residents, these are the commitments that we need to continue to make and the investments we need to continue to make in our community to serve. And then lastly, we think about integration and how we integrate together. Let's be honest, there's not one healthcare organization that's going to solve this problem for the community. It's how we do this together. And that integration can mean several different things. And it wouldn't surprise anyone here in this room if we were to give a laundry list of opportunities that we have to improve access to care. Whether it's the under-resource of primary care, the overutilization of high-cost care. Patients are feeling that. And they may not be able to call it out specifically, but it's up to us as healthcare professionals and as organizations to understand where we can partner together to really decrease that friction for patients. And so Intermountain's looking at opportunities for where we can partner across the care continuum for patients so that we can make sure that when that patient is having a mental health crisis, or that patient needs to learn how to better manage their diabetes, or they're concerned about a lump in their breast that they just found, that we're creating the pathways to make that care as safe as possible, the highest quality as possible, but in the time that they need it, and in a supportive way so that it doesn't feel as fragmented as perhaps they may be experiencing today. And that's where I think we can commit together to integrate together and really understand how we improve that care for each individual patient. Because at the end of the day, it's about that one person. Your mom, your dad, your brother, your sister, your neighbor, whomever that may be. That's who we're here to serve. And I think as we think about all of the comments that have been made tonight around how we invest in the next generation of healthcare providers, how we grow together, and lastly, how we integrate together is what's going to really propel this forward. So thank you so much, and again, I appreciate the invitation.
Thank you, Cara. Our next speaker is Dr. Aury Nagy, Neurologist, Vice President of the Medical Board of Examiners. And the topic is issues facing our physicians and practitioners, solutions on credentialing, approval process like other states. Why does it take so long, or apparently 6 months or so, to be credentialed here in Nevada?
Speak today. Thank you, Rita. Hey, so excited to be introduced by Sue Coffee. I grew up watching.
That makes me old.
You look exactly the same as you. I am not an eloquent speaker as a lot of people who spoke today, so I'm going to read a bit of this. In terms of why it takes so long for licensure in Nevada, I was not aware that that was a specific topic, but I can address that. Nevada statute is that we have it's 14 to 30 days to turn a license around. Once we have all of the information available on any given applicant, we turn it around in that time. The difficulty comes in that the applicants here in the state of Nevada oftentimes don't present all the information that is required. So most of the time that it takes is the accumulation of all of the relevant information about that person and their medical history, education, other actions that have been carried out against them, perhaps in other states. Once we have all of the information that's available about a doctor, then we make a decision about whether or not to license the nurse.
Thanks, Dr. Nagy. Our next speaker is Dr. Upinder Singh, Senior Medical Director, Centene Health. And that topic is going to be the importance of health and other components of health insurance, such as health insurance for the underserved community.
Good evening, everyone. I yielded my time to Dr. Nagy. 3 to 5 minutes is too long because I'm the last one standing between you and the dinner, and I don't want to be that. And everyone has spoken so eloquently about different things that are affecting our healthcare. I don't have anything to add except one thing. It is great to recruit new things. We have gone from one medical school to 3 and soon 4 medical schools. We have gone from graduating 100 residents and fellows to the number has quadrupled. Now, the bigger issue is how do we keep them here? So all the efforts that we put into bringing up new doctors and things like that, nurses, we need to keep them here. So the board can give them licenses quickly and be less punitive. And when you have limited resources, we need to use those resources very judiciously. So we need to move from where you get paid per plate to value-based care. If we don't do that, we are just wasting our time where the primary care physicians are using the patients as props by talking to the computer and fixing the EMRs. That needs to change. So there are a lot of good things happening, and we need, how do we keep them here? The nurses cannot afford good housing, even though Carla is paying through her nose, all the nurses. But when you cannot afford a home, and we spend millions of dollars putting the cones on the freeways and fixing the 215 same track 7 times in a row, we need to elect the people who can get it right the first time. So that is where it comes. I'm going to stop here. Thank you, everyone. And we need to support the Nevada Donors Network because so that we stop shipping our organs out, so that Harry Reid is not the airport is not the best place for healthcare. So we can save those lives right here. We should stop spending millions of dollars just renaming the airports too.
I guess we needed a little of that levity. Thank you, Dr. Singh. Okay. Oh, hey, you were the last major speaker. Yay! Come on, let's give her a hand. Okay, but we do have a little bit more business to do before the food, so it's not right now. I'm not standing in the middle of it right now, but it's very brief and very wonderful things happening, and we want to mention that to you. Along with saying thank you to Las Vegas City Councilwoman Victoria Seaman, she snuck in. A little bit there, she snuck in. Thank you for joining us tonight. And now we want to talk about the launching of 2 groups tonight. These are the announcements. Showers of Blessings. It's a new project with portable showers for the homeless to include health assessments in collaboration with Nevada Community Health Center. We're going to be bringing up Odessa Ferreira and Barbara Harrington to say a few words about the Showers of Blessings.
Good evening, everyone. This is just Odessa.
That's catching on now.
Yes. And this is my partner, Barbara. I'm an administrator of Royal Springs Healthcare and Rehab. This is my director of nursing. But this is not something that we do inside the skilled nursing facility. this is something that we thought about we can do for the community of Las Vegas. We're going to be providing portable showers for the homeless communities. And would you like to add something else?
One of the reasons we came up with this idea is because in our professional setting, we come across a lot of people that are homeless. They come for rehab and they have nowhere to go. And we see what kind of shape they come in. And I even had a gentleman tell me once, he lived on the streets, he says, I wear black because you don't see the dirt as much. And so if this is a way we can reach out and help them, and in partnership, we can also provide them some health screening, and we already have contacts with some partners that would make some donations to these individuals so we can help them in a comprehensive way instead of just a shower.
So this is in collaboration with the Nevada Community Health Center. Thank you, Harry and Rita, for welcoming us to collaborate with the NCHC. Also at the same time, I would like to recognize the officers. Barbara Harrington is the CEO, Odessa Ferreira, myself is the president. Sharon Tanyag is our secretary, unfortunately she's not here. Ruth Ramirez is our treasurer. The board members that we have, Emerald Reese, Miriam Garber, and Rodney Johnson. We're looking forward to serve the community at Redmond.
This just name so reminds me of Will and Grace. I think that's where it started, right? Just Jack. Just remember that, right? That's coming back to me now. Now we want to introduce the Nevada Care Providers, a portal up for NPHN, all about senior care providers, group homeowners, administrators, caregivers, hospice care, and more. So if I do call you up, please come forward for a photo op. We have Faith Ramos, President, Nurse Group Owner and Administrator. Odessa, it's Odessa, Vice President Administrator at Royal Springs Nursing Home. Lynn Coe, Treasurer, Group Home Owner. Rose Azucena, Administrator, Group Owner. Inducted, what? Lydia Seaboot, Caregiving Instructor. Helen Regal, Group Owner. Okay, did somebody, did you want to say something? Okay, we're good. All right, photo op, everybody. Oh, we have another photo. Okay, yeah, keep them on.
Harry, you have to say a few words before he does that. I'd like to remind everybody that you have that form on your table. Please fill it out. If we are running out of copies, please let Faith know. We would like everybody to be a member tonight. What is the benefit? You're actually going to help the community. We're not reinventing anything. We're actually doing the work that people talk the talk. We're doing it through your help. So right now we have 400 members. We're hoping before the year is over, we can reach a little over 1,000. And there's no charge to be a member. Why do you want to be a member? It's because we will connect you with other healthcare providers. Once you know each other, you're able to come up with ideas, just like what Odessa is talking about. She thought about it, and instead of reinventing and making her own, we collaborated with her. Yes, we do need to have those portable showers for the homeless. Now that's the first one. Thank you, Odessa, because that really is needed. If you have certain ideas that you want to do for the community, let us know. We will collaborate with you. We will not reinvent the wheel, and we will not keep going around and around, and it's your project that we will promote. It's yours, and it will be yours forever. But let's help our community. The underserved community is increasing in thousands and thousands of them. And one of the new projects that we're working on, again, we don't stop, Autism Project, adults, not the younger ones. If you have any idea how many adult autistic are sitting in jail right now, it's a little over 1,000. They're not criminals, but they have no place to be. And nobody has diagnosed them when they were younger age. So they are sitting there, probably to sit there forever. We need to rehab them. We're looking for volunteers to help us. How do we take care of this 900 plus or 1,000 plus autistic adult. And then we have the Down syndrome too. Dr. J. Pan, you just arrived, come here. He's taking care of a lot of the kids that are, mental behavior. He's one of our board members. Doc, can you say something about what you're doing for these kids? Thank you.
Well, thank you so much, Rita and Harry. I'm Dr. J. Tan, and I'm a nurse practitioner at the same time. I was previous president of the Nevada State Board of Nursing. So I was really impressed with the speakers we have talking about the collaboration of doctors as well as nurses for the state of Nevada. There's a lot of things that we need to work on as a community for this. I'm talking about the special population of autism. There are a lot, and in my own practice, I've seen the proper diagnosis along with the help of other disciplines such as psychologists, we could properly identify this population and help them grow with less burden in their self and for the community. So together we could at least work together from the nursing perspective, the medical perspective, the community healthcare perspective, as well as academia, which I'm also an assistant professor at UNLV School of Nursing. Together we work as a community and build up a community that's caring for each other. I'd like also to acknowledge the Philippine Nurses Association of Nevada right there. So thank you so much for the support. Thank you.
Thank you, Dr. Tan. Did I miss anybody here tonight? We want to help the community, and like I said, you can be part of us. This all started when Harry thinking about the Nevada Community Health Center, NCHC, which is at the 1311 South Maryland Parkway, corridor of Charleston. We are going after the homeless, the underserved, undocumented, underinsured, or uninsured. There's a big population out there, and it's all going to be part of the FQHC, Federally Qualified Health Center, as it should be. And Dr. Calderon, can you stand up, please? We need to recognize you. He's our medical chief. He can't get up there. Okay, thank you. This is a great job. And when we started that, we realized their collaboration, autism, Down syndrome, then Odessa's showers. We're looking for partners. We're looking for collaboration, because if we do it together, we can help our community. Am I right, Victoria Seaman, City Councilwoman? You're going to help us a lot with the city. The city needs a lot of it. Now I think it's time for Harry.
Good evening, friends. Nothing much to say today, because everybody is much more experienced and they are the masters of their own field. I have a few words to say, only thank you. Thank you all, what you're doing in your own spectrum, your own field. Thank you those who are supporting me to do new ventures. It's a very short period of my life. Here in Las Vegas, about 5 years ago, when I started finding it out where the disconnect is, where the gap is. And with my journey of 5 years, I found like-minded people join together, come forward, and encourage me to do something different. So today I'm proud that I'm running around 6 organizations. In a span of 5 years, I'd like to serve the community which is underserved. When I see a lot of people, a lot of research is done by my other colleagues, finding it out. We have got autistic young adults and older adults in jails. And the research continued to say that they're not supposed to be there. So now we are establishing a venture by saying it, let's open up some housing, requesting our government officials to give me those dead motels, which is in a downtown area, to let me put these people out there. Let me take care of them. Why would they be living in jails? They are not supposed to be there. So thank you everyone to be here with me, to be my support. And thank you what you're doing it. Guide me, educate me, so that I can do something different with all together and make this community something beneficial who are suffering for. Come forward, be a part of us, and thank you, Joe, for always being with me to support all my ventures. and God bless you all.
I think we heard about the trip that they're going to the Philippines. I'd like to call on Donna Miller, Donna, Faye, Odessa. Those three ladies are his team that are going to the Philippines August 10th. And they'll be there for 7 days recruiting, talking, presenting how they should be coming to Las Vegas, Nevada first.
When Dr. McCoy was telling that I disturbed him and President Zaragoza, that why can't we be a little bit different? Carla was saying we are running short of 4,400 nurses. I may not be able to bring 44, but I'll bring it some percentage. The program which was created is to let's bridge these people. They wanted to come, they want to be here, they want to be a part of our healthcare system, but they're not able to. Why? Because there is a lot of issues with respect to our immigration system and government affairs and all. His team burned all days and nights and the lights over there sitting in our rooms by creating a programs, and which is going to be a wonderful success. We created a program to fulfill the gaps of these nurses who are living in overseas countries and wants to come and serve our healthcare institutions. That program which is created is for 3 or 4 months. They will go through, we will talk about Dr. Tan, who has tons of experience in NCLEX, to review these nurses, educate them to qualify with them. They will go through the nursing board to qualify their licensing system, but they must understand what is our healthcare system too, so that they are equipped with our system. So that's what I'm thanking CSN to be with me day in, day out to help me create this program. And now this team of beautiful ladies are accompanying me to Philippines. 7 days, 786 appointments, 3 days presentation, 2 days follow-up. I don't know whether I'll be coming back like this or something. But that's the scope. So get ready to welcome these nurses to come and work for us. Guide us in case if you find, we love to share some inputs with all the institution heads to guide us in case if you find any shortcomings in our program to make it more beneficial. Thank you very much.
Mary's Angel. We heard of Charlie's Angels? The 3 lovely ladies is Mary's Angel.
Just days.
I'd like to call on Joe, please. You're doing the closing for us. The reason for that is we collaborate, the first time ever we collaborated with Nevada Donor Network. Unfortunately, Steven's not here, but Joe has been so supportive. We had our first event July 7th, 2021 last year when we launched it, and it went very well. Why are we collaborating the way we are doing with Nevada Donor Network? Because you never know who needs an organ. It's very, very important that we must sign up for those donations. Because if we don't, we're going to fail ourselves. Because somebody in our family or loved one will need it, and we're going to say, I should have done this, or I could have done that. We never know when you need it, and why do we need to go outside of our state? So one of the projects that Joe is doing is to have our organ transplant institute. Joe, can you say a few words, please?
Thank you, Rita. Sorry you get just Joe. I can't say enough about how supportive Rita and Harry have been to our mission. So I think it's been a reciprocal relationship. We recognize the ideas that Harry and Rita had for benefiting the healthcare system here in Nevada, of which I have now been a part of for more than 10 years. So I came here about 10 years ago. My wife, who is a graduate of Toro and did her residency, her neurology residency here at Valley Hospital. And so we met here in Las Vegas. She's now in Miami doing a neurocritical care fellowship because that's not offered here in the state. Otherwise, she would have done it here. So my father is 83 years old, practicing physician, still delivering babies, still doing surgery in Miami, where I sort of grew up. So healthcare and medicine and doctors and nurses and all of the allied health professionals, it's been a part of my life for as long as I can remember, and it really resonates in our mission at Nevada Donor Network. So Rita asked me to say a few words about the Nevada Transplant Institute. It is an organization that we are forming, and it's in its infancy, so I can't share a lot of details, but all I can tell you is that 90% of the organs that are recovered from heroic donors here in Nevada are exported to another state to be put into a recipient in another state. Nevadans have to go to another state to receive an organ that was recovered here in Nevada. We at Nevada Donor Network have managed to be the top or among the top performing organizations for organ donation. And so you think about that conundrum where we have health systems here, we have smart people here, we have capable doctors here, we have capable nurses, and the fact that we have more donations for organs, tissues, and eyes here than anybody else in the country. And as Nevadans, we have to go to another state to receive those organs. It just doesn't make any sense. And let's not even talk about the financial implications, the economic implications that that creates, and the talent vacuum out of the state that that also creates. So I could go on and on. As you can tell, I'm very passionate about this, and one of the things that makes me most passionate is people like Courtney Cow. She's a donor mom. Mikey was a heroic donor that we all know, and we've heard Courtney talk about this in a group similar to this. It really should be every Nevadan's mission to solve this inequity that exists. The fact that we have more donations here than most other, if not all the other states, and as a Nevadan you have to go somewhere else to receive heroic organs like Mikey's, who unfortunately we had to facilitate that and make sure that his gifts went somewhere, because we don't want heroic Nevadans to lose their lives in vain. So we want to save lives no matter where those lives are, but we also want to make sure that we take care of Nevadans first. And so at Nevada Donor Network, through the foundation that Stephen runs, we're really close. We're really close to being able to solve this problem. We think we're going to get the funding for it. And that's all that's necessary in terms of catalyzing the program. But once it's catalyzed, we need all of you to support it, to make sure it's sustainable on behalf of future generations of Nevadans. So let's not even talk about people in this room and our kids and our parents. Let's talk about future generations that are going to benefit from a transplant institute here. If you need a kidney, you can get it at UMC, but if you need anything else, you're going to have to go somewhere that's not Nevada. So I just want to acknowledge Courtney for her advocacy, this room for your support, Rita and Harry for your belief in us as an important part of the community throughout the state. But I plead with you, once we get this going, please support it and sustain it so that Nevadans don't die who can't afford to go to another state. So, Courtney, did you want to say a few words?
Oh, yes, thank you. I had no plan coming up here. I just want to thank everybody for being here. You are all the movers and shakers and doers of the state. And 3 years ago, my life changed forever when my son was in a tragic motorcycle accident. And
a year before that, he chose to be an organ donor. He checkmarked yes on the application at the DMV all by himself because he was 18 and he got to do that. So it took the thinking and the guesswork out of it when it was my turn to be on the other side of the bed, because I too am in healthcare and in hospice, which is actually why I chose that field, because I felt like I had a story and a purpose and a passion that I could help other families in the place that I'm in. And that also includes bringing awareness and the message to checkmark yes, because each and every one of you is somebody's hero. Of course, I love my son to death, and he's my pride and joy. But I actually also have had the opportunity of meeting the individuals that received some of Michael's organs and to see the actual life change that happened, not just for them, but their family, their community. It's a big deal. So thanks again for all of your support. This is just the beginning, and I appreciate your time. So, just so you know, typically the information that we get as donor families is they'll give you a list, something like 40-year-old male, left kidney, 25-year-old female, right kidney. That's really the only information that we get. So, at this point, it's been about 3 years, and we spent Michael's 20th birthday with Michael's double lung recipient, Harold, in Texas. And I did receive a very beautiful, grateful thank you card from the individual that received Michael's liver, a 57-year-old male. But it's just been an absolutely amazing journey to see the life change and see Michael live through someone else. It's just amazing. So.
One final thank you.
Chris Perry, where are you?
He's in the kitchen.
Right there. This is it. Come here, Chris. Don't hide. We need to let you know who owns this restaurant. Very nice, loving guy. His wife and him has always been very grateful. I mean, we're so grateful for him because he opens this door for us on Tuesday evening. This is Chris Perry, who owns this restaurant. And this location, but he's got one on Flamingo and San. What is it? Yeah. Flamingo and Bayou and LB. Then he owns another one and down by the strip.
It's next to Encore.
Okay, next to Encore. Oh, that's right.
And we have one in Henderson.
And one in Henderson. So this is our Chris. Thank you, Chris, for helping us. Thank you. Ladies and gentlemen, we apologize that we went a little extended on the time. Dinner is ready. It's on the buffet. Its two sides are available. And I'd like to please call on our sponsors first to please stand and get to the line first. You don't mind.
Go for it.
Come on. Just Joe. Just Renee. Just Kit. Maria.